Hey guys, welcome back to Medical Coding with Blue. It's Quiz Friday. So I will go ahead and give you guys the questions. I will be including the questions down in the description box below, so you don't have to hurry up and write them down. If you have a 2018-2019 version of the ICD-10 book, you should be good to go. If you have a 2017, 2018, or 2019 version of the CPT book, you should be good to go. I threw in here some modifier usage, some procedures. There is a question in here about E&Ms, but it's not about a level because I didn't write out a scenario for it. All I want is the modifier in relation to the E&M. That's all I want. No, there's no E&M leveling. I just want the modifier that would be appended to an E&M level. Okay? So let's get started. Number 1 is a left Lisfrank fracture, initial after falling downstairs. Number 2 is a follow-up 1-year status post right knee joint replacement. Okay. Number 3 is a right tibia and fibula distal fracture, subsequent visit. The patient is here for a follow-up and a replacement of their cast. The patient was recasted with a short leg cast. The patient tolerated well. Okay. Number 4, the patient has a chronic ingrown right big toenail ever since he fractured his right big toe a year ago after he dropped a dumbbell on his foot. He had a matrixectomy of the right big toenail. Okay. And ingrown toenails on a fractured toe are, pretty common. It does happen because the way that the nail grows back out after it's been injured. So, moving on. Number 5, the patient has developed bursitis in the left hand due to typing an essay for their English class. Okay. Number 6, the patient is a follow-up visit 6 months after a right ankle sprain. The patient healed nicely and is cleared to return to normal activity. Okay. Number 7, the patient has left hip primary osteoarthritis. The patient had a left total hip replacement. Okay. Number 8, the patient had 25 skin tags on his neck and chest. All 25 skin tags were removed with scissors. Number 9 is a follow-up visit 1 year following right radius open fracture. Okay. And number 10, the patient is post-op 3 weeks for left knee arthroscopy. During the visit, the provider sees a right arm 6-inch superficial laceration. After inquiring, the patient says that the cat scratched him. What is the post-op CPT code for this scenario? And what modifier would be applied to the E&M? Okay? And those are your 10 questions for this week. We will be discussing the answers, as I mentioned, on Answer Monday, so I'm excited. Remember, look at your modifiers, look at all your diagnosis selections. Just pay attention to those details, okay? Today was a very eventful day, as always. I have not 1, not 2, but 3 meetings for the month of August. My calendar is filling up quite quickly. I have to do an internal audit for one of my providers. I actually have to do 3 different providers, but I hit the first one today, and we have our face-to-face in August. So I'm very excited about that. I like being able to have that dedicated one-on-one time with my providers because sometimes, especially if you're doing group teachings a lot, sometimes providers don't really want to talk in those meetings because nobody wants to be the person that's, raising their hand, even though there are some people that don't care and they will raise their hand anyway. Nobody wants to feel like they're the one asking all the questions. So sometimes it's better and less nerve-wracking for everybody if you have one-on-ones. So this is a good opportunity for that, and I'm excited about it. I got the official invitation today for my 10-year award ceremony at work, and so I'm very excited. I had to, and for our ceremonies, we get to have somebody that we pick, anybody. It could be our supervisor, it could be a close friend or colleague, stand up there and speak for us and talk about us and, just tell the people about who we are. And I asked my supervisor today if she would do it because this is an invitation thing, and they need to know who's speaking for you if you have anybody speaking for you. And I asked her if she would, and she said yes. So I am lucky that I have her, even though of course we butt heads, but I would rather work with her than anybody else, I guess. She's been very kind over the years, and I've learned a lot from her. So I do feel lucky in that sense. She's just a nice lady, and like I said, I've really grown as far as knowing how to back myself up with arguments, and she's given me that little bit of stretch to really work on making sure that I have all my bases covered whenever I do argue something, because she's prepared too. And so I like that. And I like that she's willing to listen when I'm showing her my evidence. Sometimes you may not always find that, and it's good to have that, good to have that learning back and forth. So like I said, I'm very lucky with that. And so that's about it. But she did say that she would speak for me, so I think she was a little surprised when I asked her. So, but anyway, I'm looking forward to that, and that will be next month, and I will get my official certificate, so I'm very excited about that. And so anyway, yeah, that was my week and my day and everything. So I hope you all have a great weekend, and as I said, if you have any questions, let me know. I'm still formulating my list for Q&A Tuesday, so there's still time if you have any questions, so let me know. All right, well, if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I hope you'll like and subscribe and follow me on my journey in medical coding. All right, well, y'all have a good weekend, and I will see y'all on Answer Monday. Bye.